So I'm Neve and I'm your Vice President of Student Activities, and today I'm here with Dr. Gemma Moore and we're just going to be having a little chat about the vaccination programme in the UK as we're getting 2 vaccination pop-up centres at St John's and at City Campus. So how are you today?
Oh, I'm really well, thanks, Neve, and thanks for inviting me to come and speak to everybody today.
You're so welcome.
Yeah, really excited, and I just want to get over the positive message about vaccination and encourage as many people as possible to take it up, really.
Lovely, you're so welcome here. I'm so glad you wanted to do this with us. Yeah, so we'll just start off. Over the past year, obviously in the news, there's been quite a lot of speculation about young people and COVID. So is it true that, young people aren't at risk for COVID?
Oh, I'd love to say young people are not at risk, but unfortunately they are. I think young people are very at risk of getting COVID. So first of all, of actually catching COVID and, being unwell with COVID. And if we take a look at a snapshot of who's in intensive care at the moment, if you take sort of 5 people, every one of those 5 people, 1 out of the 5 will be under the age of about 25, 30. So we definitely know that young people are getting COVID and unfortunately they are getting unwell with it. So that's the first thing. The second thing is we do know that young people are suffering with long COVID as well, which is just awful if people are getting long COVID. I'm a GP locally and I see quite a lot of patients who are suffering with long COVID, lots of fatigue, lots of change in their lifestyle, really can't manage to do what they wanted to do before they were unwell with COVID, which is just really sad when you see a 22-year-old that, can't manage to play sport or they can't go clubbing anymore because they just feel so tired with it all. So, they're getting poorly, they're getting long COVID, which is affecting their long-term health outcomes. And, they're transmitting it to people. So, you just don't know who you're going to be with, what medical conditions they might have, vulnerable adults, vulnerable children, older people, and the risk of transmission is quite high. So yeah, I would love to say it's not affecting young people, but it really is. I've personally had a couple of patients really affected by long COVID. I had a young lady in her 20s who nearly had to have her fingers and toes amputated with long COVID symptoms and complications, which was really sad. Thankfully that didn't happen, but she was really poorly. And I've had a couple of other people that have been quite unwell with it as well, which is just really difficult to see.
Speaking as a healthy 22-year-old who's had COVID and I have no underlying health problems, it absolutely swept me off my feet and in bed for a week and a half, and luckily there was Netflix, but at the same time there was that kind of mini heat wave going on and it was awful, and my sense of smell and taste is still not returned, but I got quite lucky. It was horrible, and I'm so relieved now that I have both vaccines, just so I have that kind of little relief in the back of my head that it won't be as worse next time if it was to happen. But I would just recommend the vaccine to anyone because it's just an awful process to go through, and I was lucky, I really was, but some people unfortunately aren't.
Exactly, that's it, it's potluck of, are you going to be lucky or are you going to be unlucky? Are you going to get long-term consequences from it or not? And all the evidence is showing us that the vaccinations do protect people, and they might not always stop you from getting COVID, but they are going to stop you from getting severe complications or hospital admission and then long COVID symptoms and things afterwards. So massive advocate of the vaccine. We've vaccinated loads of young people at my practice. We haven't seen any complications or any side effects or anything untoward, so I just hugely encourage people to take it up. 5-minute job and then you're protected.
Yeah, so would I, 100%. So obviously the vaccine has come quite quickly in the last year and developed really, really quick. Is it thoroughly tested and, is it kind of trustworthy, I suppose, from a student's perspective?
Oh gosh, yeah, absolutely. I think medicine just changes every year, every few years, what we can do now and what we couldn't do 5 years ago, time just flies. So the vaccines have been totally developed properly, really well researched. The processes have all been independent. So we've had an independent body certifying that the vaccines are safe, saying that they're effective and things. And then we've had other bodies making decisions about who gets them and who introduces it. So all the conflicts really been taken out of it, so it has been developed really quickly, but thank goodness, if it hadn't been developed really quickly, I don't want another winter in lockdown. It's really tough on everybody, it's pretty miserable. So the only way we're getting out of this pandemic is by vaccination and is by people being sensible. So I'm actually really pleased it was developed really quickly, and my practice locally was one of the first practices to try it nationally. And we were really proud and really excited to do that for our patients, and it was just it was fantastic. So I'm totally convinced it's all absolutely fine. And as I've said, we've probably, I don't know how many vaccines has my practice done. My practice has probably done about 50 to 60,000 vaccines since we started in December, and we've seen very little side effects or consequences. So it's been really good news.
It's crazy to imagine, where we are here compared to where we were last year.
Oh gosh, I know.
Isn't it?
Yeah.
It's wonderful.
I know.
It's
really positive. It's really positive. So yeah.
It is. So from a student's perspective, or a young person, or anybody who hasn't had the vaccine yet, what are the side effects of getting your first jab or your second jab?
Okay, so you could be totally lucky and get absolutely no side effects whatsoever. So lots of young people have been absolutely fine with their vaccine, and I've said to them, how was it? With any complications? Then be like, didn't even know I had it. It's been fine, absolutely fine. But the really common things are going to be arm ache. So most people do get a significant arm ache, and when I had my vaccine, my arm did hurt. A couple of days it felt like it was just really heavy. I didn't want to lie on it that night in bed, but after that it was fine. So after the arm ache, then the common side effects then are mild headache and just feeling a bit under the weather, so mild flu-like symptoms. So people just feel a little bit achy, just a little bit not quite right. Some people describe it as mild flu. Some people describe it as being a little bit hungover. But, it's all quite mild. Nothing that a bit of paracetamol is not going to settle in an early night, and then absolutely fine afterwards. And again, second vaccine, then once people have their second vaccine, they either report no symptoms or mild symptoms again with it all. So, I think, if you look at the benefits of vaccination and, not having a hospital stay, not being really unwell and things, 24, 48 hours of being mildly unwell, I think most people would cope with it.
Yeah,
be fine.
A typical student would be used to it, wouldn't they? Fresh as flu.
Yeah,
it's the same.
Exactly. You might as well just have it done.
Yeah. Another question we have from students is what is in the vaccine, and is it suitable for vegans if that is an option?
Yeah, so you wouldn't believe it, but there's actually very little in the vaccine. So when we get the vials, they're really tiny and they've got hardly anything in them. And essentially, it's just the active vaccine that's suspended in a little bit of a fat molecule. So it works in a fat molecule. And then what we do when we get the vaccine is we mix it with water, saline, and then we just inject a really small amount into the upper arm, and it's done. So absolutely nothing in it, nothing untoward at all. So I'd encourage vegans, everybody to get it vaccinated, just get vaccinated and have it done.
Oh, lovely. So everyone can have it. It's open to all, isn't it?
Yeah, absolutely.
Oh, fantastic. So with that in mind, is there any kind of warning or people should be aware about if they have intolerances or allergies?
We do ask for extra precautions with people who've had previous anaphylactic reactions. So people who've got an EpiPen, we just need to be careful about what vaccine we're giving you and just take a thorough pre-history, so ask a few questions and things before. But even those patients with allergies and EpiPens have been having the vaccines. We've actually got a specialist allergy service in Worcestershire as well. So if you are deemed to be slightly a little bit more high risk, we're arranging for you to have it done at the hospital, so it's all done in a safe environment. So before your vaccine, you'll be asked lots of pre-health questions. I say lots, 10 or so questions. It seems like it's a lot, but it was all done in about 30 seconds, and then we'll decide whether the vaccine's safe for you, have a conversation to make sure you're happy to have it, warn you about the side effects and the after effects and things, and then just do it. And if you're not suitable, we'll arrange for you to have it done in a different setting.
Yeah. Oh, it's all great then, isn't it?
It does seem, it's like when we launched it, we were all really worried and really like, it was just, this is a great big new thing that we're going to be doing, and we were very slow to do it. And now we can get through quite a lot of vaccines in a day, and it's all quite slick and it's all quite quick.
Yeah.
So,
Yeah. When I went for my vaccine, it seems like such a well-oiled machine now, doesn't it? It's like it's nothing anymore.
Yeah.
It's
we're well used to doing
fantastic.
big volumes now. We can get through sort of 1,200, 1,600 in a day in most of the pop-ups or the vaccination centres. So you're not going to be there very long. You won't have a big queue or anything like that. It'll be in and out, and you'll be done carrying on with the rest of your day.
You do it in your lunch break.
You can do it in your lunch break. You can do it before a lecture. You
You
can do it in
could.
your coffee break.
You could. So obviously, speaking from a young woman's perspective, and obviously I represent nearly 10,000 students here at Worcester. Does it affect fertility in a way, and is there any kind of concerns that young women should have around this?
No, absolutely not. So there's no data and no evidence that it affects fertility at all. We've got an international vaccine now that's being used all across the world. So the data is absolutely enormous, and there's no evidence of fertility issues or potential complications if you have it when you're pregnant or when you're breastfeeding. I've certainly given it to lots of pregnant ladies and lots of people that are breastfeeding. I've got colleagues at work that are pregnant or are breastfeeding and I've had it, and if I was in that situation myself personally, I would definitely still have it, because again, unfortunately, what we're seeing is that if you're heavily pregnant and you haven't been vaccinated, you're more at risk of getting complications and being hospitalised with long COVID, rather than it having any implications on the baby or the vaccine affecting your fertility. So we're encouraging at every point of the journey. Like I just say, just get it done. Honestly, don't worry about fertility. And if you were in your early days of being pregnant, or if you were breastfeeding, again, just come forward, have that conversation with the clinician so they can talk to you about it and reassure you from any worries and things, and then just to do it, really.
Fantastic. Well, you've kind of answered my second question
sorry,
there about breastfeeders, but you're just a natural, aren't you?
They're always linked. Pregnancy, breastfeeding and fertility. I think as a female GP, you're just zoned into it. You know what's coming next with it.
Yeah, but it's good to know, isn't it? Because just in case and just to have that knowledge there is at the back of your mind, just to put you at ease. It relaxes you so much, doesn't it?
Yeah.
Okay, so my best friend, she's absolutely petrified of needles. She won't go anywhere near one. So she was quite nervous about this process. So what is in place to support people who do have, a little bit of phobia of needles?
Well, loads of things. So obviously it is really quick. Like, it's a 2-second job to actually do the immunisation. So, if somebody comes in and says to us that they're feeling slightly anxious, we do all sorts of things, from trying to sort of get them to the front of the queue so they don't have to wait in the queue if there is a queue. That there shouldn't be a queue, but if there is a small one and they're building up and things, we'll try and get them in. There's always a doctor, there's always an administrator there as well. So, just trying to talk them through those fears. And I'm just a great believer of just doing it really quickly, because I think the longer you sit in the chair waiting for it, the more anxious you get. But as I've said, it does go into the upper arm, and it's a really, really tiny little needle. It's so fine, and it's such a small amount of fluid that goes in. It's really tiny. So it's just to do it really quickly. But, we could do it if people want to lie down rather than sit up, we can do that. If people don't want to look, they don't have to. If somebody's really anxious and they want to bring somebody with them for company and things, all of those things are fine. You just need to communicate it when you start to come to the vaccine centre or to the pop-up clinic, just to say, look, I'm letting you know I'm a bit worried, or, is it okay if such and such comes in? But, I've had a couple of faints from younger people, but hardly any, and nothing more sinister or serious than that. So just come forward, get it done. Honestly, I think most people look at me when I've done it and say, "Have you done it yet?" And I'm like, "Yeah, it's already done. Come, see you later. See you in 8 weeks. Off you go." So it's just really, it's not a big deal.
I had a chat with my nurse about Downton Abbey when I had mine, and I didn't even know it went in. So it was fantastic.
Oh, that's good to hear.
So when I had my vaccine, I had Moderna, and I know there's a lot of quite different types available, especially in Worcestershire. Predominantly. So what are the differences between these different types of vaccines?
So we've got 3 different types of vaccines that we're commonly using. We've got the AstraZeneca, we've got the Pfizer, and we've got the Moderna vaccine. We're actually not using very much of the AstraZeneca at the moment, just because of the patients that we're vaccinating. So there was some safety concerns with AstraZeneca and blood clots in those that were under 40. So we're now not using it in under 40s, and we're predominantly using the Moderna or the Pfizer vaccine. So for all the new students potentially coming to the university, or the younger people around, it would be Pfizer or Moderna now. They both work in a very similar way of immunising you and giving you the protection, but there is choice and there isn't choice. So, we wouldn't want choice to be a barrier for anybody coming forward, but we do like to follow the national guidance and the national policy, and currently that would be that Moderna or Pfizer would be suitable for anybody that was under 40. And we will be using both vaccines across Worcestershire for that cohort and in the pop-up clinics and things. Personally, I don't think there's much of a difference. They offer the same protection, it's the same sort of thing, so I wouldn't be worried about which one I had if I was having my vaccine again.
As long as you get the vaccine,
exactly.
That's all that counts, doesn't it, really?
Yeah.
That's fantastic. So what kind of personal information, or what do you need to bring in your pockets or your bag, or just have in your car when you go and get your vaccine? What do I need to bring with me?
So you don't need to bring anything at all. You literally just need to know your name and your date of birth, and you just need to come willing to have it. So you'll either be asked a few questions, you might be asked to fill in a piece of paper just to say that you're fit and well, or the pop-ups in the vaccination centres run slightly differently, but other than that you don't need anything. So please don't let that be a barrier. If you haven't got an NHS card, or even if you haven't got an NHS number and you're an international student, it doesn't matter, we'll still vaccinate you. You don't need to be registered with a GP, you don't need anything with you, we just want to get it done and protect everybody. So that's not an issue at all.
I'm so relieved to hear. I think I bought a big folder of every classification of identification I had, just in case. So,
just in case.
So that would probably have been good to know before I went for my first one.
You would have been the dream, because they'd have found you straight away, otherwise we have to search you for a little bit and say, where are they?
I would have given them anything they asked for. And just one last question. This might sound like a bit silly, silly, but I know for me especially, I probably needed this information. But what do you wear to get a vaccine?
Oh gosh, absolutely anything. Again, it doesn't matter. If you're going to be a really good patient and really sensible, if we can get to your upper arm, that's perfect. So t-shirt, vest top with a jumper or something on over the top that you can take off, that's fine. But you know, we're going to do it anyway. So we've been taking shirts off, people have been popping arms out of dresses, anything really. You know, it's all private, it's all confidential, and we'll do whatever makes anybody comfortable. So again, it's not a biggie for us, whatever you want to wear.
Oh, anything. Absolutely anything.
We just want to get the vaccine in people's arms, you know, and offer that protection and really just enable everybody to get back to life as normal.
Yeah.
You know, that's the big thing. Keep life going, keep everything normal, keep these lovely students at university having a lovely time, which is what they should be doing, rather than worrying about isolating and passing COVID on to people.
Yeah, we've all got like the same goal, haven't we?
Exactly.
So that's all we want in the end.
Yeah.
It is. Thank you so much for coming and asking all my silly questions and non-silly questions today. It's been a pleasure to have you here and just put students at ease.
Oh, you're very welcome. It's been great to come, and you know, I really hope I've encouraged a few people to come forward and have their vaccines, because that's the aim of the game. And you know, no question is too silly or no question is too big. You know, please just ask those questions when you go for your vaccine. And yeah, it's been great to be here and be part of it. And hopefully, I might see lots of students when I come and do the pop-up clinics, which will be lovely.
You're always welcome back.
Thank you. That'd be
Thank you
great.
so
Thanks.
much.
Thanks.
Thank you.
Thanks.